Good afternoon, everyone. Today, we have another clear indication that COVID-19 is in retreat in Northern Ireland. A second day where our trust labs have reported no new positive cases. Whilst the number of deaths continue to fall and the restrictions continue to be lifted, sadly today another life has been lost to this terrible virus. And my deepest condolences go to the family and friends of this person. Coronavirus has taken a terrible toll on this community, just as it has in countries around the world. But we must never forget about that destructive power. As we move gradually out of lockdown, we must keep our defences up. Social distancing and hand washing are still the central message for me. That's how we keep COVID-19 on the downward trajectory. If we relax our guard now, the consequences will be extremely serious. Let's remember the scale of the threat back at the start of this. How we watched those terrifying scenes in Italy of a modern European health service being overrun. How we feared our own health service that was already in a pretty bad way. How we prayed that we would have enough ventilators to treat everyone who needed it. So let's never lose sight of just what this community has achieved together. Decisive action was taken, and it made a massive difference. As a society, we stayed at home. We saved lives, and we protected the NHS. So let me once again thank the people of Northern Ireland for this collective effort, because it will certainly go down in history. And let me also thank staff across the health and social care system for all that they have done. Staff right across the system in our hospitals, our care homes, our GP practices, and so many other care settings. Staff in the department, the Public Health Agency, the Health and Social Care Board, in trusts, in the RQIA, the Ambulance Service, the Northern Ireland Fire Service, Community Pharmacy, and all the other organisations that make up the HSC family. Workloads and pressures beyond anyone's experience. Staff on the front line dealing with scenes that will stay with them forever. Yes, there will be lessons to be learned, but we were and are still fighting an unknown enemy, with no hindsight or rule book or guide for us to follow. People did their very best and gave their all, and I thank each and every one of you for that. I have no doubt there is exhaustion on the front line now, and whilst the number of cases and deaths continue to fall, we mustn't forget that staff right across the country are still working extremely hard in responding to the challenges. Testing and tracking are now key at this vital stage of our battle against the pandemic. Over 127,000 tests have been taken, and as of yesterday, there have been 11,467 care home residents tested and a further 15,540 care home staff tested. And I would remind all those listening who may be displaying symptoms to please come forward and be tested. And while focus is increasingly turning to make sure we provide all the support we can, that means also looking after the physical and mental well-being of our people. Mental health is a major priority for me going forward, and I look forward to discussing that vital issue with Assembly colleagues later this evening. But before I hand over to the Chief Medical Officer, I want to say a few words about the departure of the RQIA board. I am, of course, sorry that it got to this point. The department took decisions at pace in the teeth of a full-scale emergency. Similar decisions were taken in England, Scotland, Wales, and the Republic of Ireland, and there were reasons for those decisions. And whilst the resignations are regrettable, I am confident that they will have no impact on the day-to-day work of the RQIA. I continue to have total confidence of the staff that work within that organisation. And within hours of the former board members resigning, I moved to appoint Christine Collins MBE as the new interim chair. I am confident that Christine will further strengthen the voice of people who use the health and social care system, something I am personally very keen to see. And as I've said before, standing at this podium, I am committed to improving regulation of our care sector. I am determined to secure a better future for our care homes and those who reside in them through investment and reform. I recognise, however, that the board resignations will have caused some concern. So today I'm announcing an independent review into exactly what happened. I have asked David Nicholl of on-board training to undertake a review of the circumstances that gave rise to the recent events in RQIA. David has a wealth of experience in this area and is a highly respected independent figure, and I look forward to receiving his objective analysis of the position. I'll now ask the Chief Medical Officer, Dr. Michael McBride, to say a few words.
Thank you, Minister. Today is the second day in a few days that we've had no new infections. That is welcome news. But we must also remember that sadly one more person has lost their life to COVID, and I want to take this opportunity to send my deepest sympathies and condolences to family and friends. This virus hasn't gone away. It remains a very real threat. We will continue to see localised outbreaks and clusters of infection in the coming weeks and months ahead. And while the figures in Northern Ireland are low in comparison to other regions, we must remember, as Minister has said, that this has only been made possible by a societal effort on a scale not seen in many generations. It is these efforts that have enabled the Northern Ireland Executive to announce further easements to the restrictions. Once again, I want to put on record my thanks to everyone who has given up so much to help protect themselves, others, and ultimately our health and social care system. All of your actions have made a major difference to where we are now and where we stand in terms of the transmission of this virus. I would, however, wish to urge caution as to what has been so hard-earned at such a price needs to be protected. Progress requires restraint and continued vigilance. Complacency remains an enemy, and each measured step will only bring us forward if accompanied by awareness that we must all adhere to the guidance that remains in place. I know how difficult it has been for families and for friends to be separated for such a prolonged period of time. While it has not been easy, it has been necessary in order to save lives. I do know, as Minister has said, that this separation has impacted on the wider health and well-being, which is why from today up to 6 people can meet indoors. Just remember that indoor environments are still higher risk than outdoors, and people should adhere to the public health advice. They should maintain good hygiene, hand hygiene, respiratory hygiene, practice social distancing where possible, and the use of face coverings is also advised to protect others. We also need to remember that up to a third of people with COVID-19 can be asymptomatic. So anyone can spread the virus, and we would again strongly recommend the use of face coverings in indoor settings where social distancing cannot be maintained. Clearly, those easements will also enable informal childcare arrangements between families and friends, and I know that has been a particular struggle for people at this time with young families. Turning, if I may, to those individuals shielding. I have no doubt that shielding has played a key role in saving many lives since the start of this pandemic. But I fully understand this has been a difficult time for those who have been shielding. Many have been feeling isolated and feeling lonely, and I want to put on record my thanks to colleagues in the Patient Client Council for their work and engagement, and everyone who responded to the survey that the Minister commissioned in relation to learning from the experience of those who have been shielding. From the 6th of July, people who are shielding can meet up to 6 people from outside their own home while observing strict social distancing. Also, people who are shielding and living alone can form a support bubble with one other household. And this allows people to visit, to stay over with a second household, and socially distancing in those circumstances is not required. It is important to remember that those people previously shielding and shielding at present, that this virus, they're more vulnerable to catching the virus and also more vulnerable to the consequences of COVID-19. A letter to those who are shielding is currently being issued and will also be published on the Department's website. This outlines updated advice and directs people to resources available for support, for example, around food deliveries, medicine supplies, mental health advice, and employment issues. Again, there has been much discussion and debate in relation to 2 metres versus 1 metre. The scientific advice on this remains unchanged. Clearly, ministers will have to take on board many policy considerations in those finely balanced decisions as to the health impacts of reducing social distancing versus the economic consequences of the current guidance on 2 metres. I think it's important to say and reiterate that the Executive has been very clear that they will keep this situation and guidance under continuous review, particularly as we see rates of transmission of COVID-19, SARS-CoV-2, fall in the community. Thank you very much indeed.
Minister Swann, Dr. McBride, Mark Devonport, BBC. Minister Swann, you say that the resignations from the board of the health watchdog, the RQIA, are regrettable and that decisions were taken at pace. Do you regret the fact that the health department has gone ahead and made high-level decisions in terms of stepping down inspections of care homes and changing the working role of senior people in the RQIA without first consulting the board of independent directors? And do you owe them an apology for that? And you said that you wish that they'd spoken to you first. Do you think that you were kept sufficiently informed by your officials about what was going on behind the scenes? And Dr. McBride, you were part of the email exchange, which has now emerged into public again. Did you keep the minister posted on how severe the tensions were in the RQIA? And should you have been more transparent, perhaps, with the Health Committee about what was going on behind the scenes?
Thanks, Mark. In regards to the decisions that were taken, I covered that in my opening statement. The decisions we took in regards to the inspections of care homes by the RQA were the exact same decisions that were taken in Wales, Scotland, England and the Republic of Ireland. Because I always think that what we have to do is put all these decisions in context of actually where we were in regards to fighting the battle of COVID-19. When these decisions were made in the middle of March, we were looking at scenes across Italy, across Western Europe, that saw people lying in the hospital corridors. So when we took these decisions, they were right decisions to make sure we had an available cohort of people who can actually support care homes on the frontline battle against COVID-19. And that's what the RQIA staff did. They stepped up and did that. In regards to the consultation with my own department officials, I became aware there were tensions between the RQIA board and RQIA senior officials at the start of May. I didn't expect it to culminate in the resignation of the board last week. I didn't think that was where those relationships had actually gotten to. So when I said in my statement that I thought there was still an opportunity for that to be resolved at that point of time, I meant that because I was actually meant to be meeting the interim chair of RQIA that afternoon, but unfortunately I received her resignation that morning, so we got to a position that relationship was at a point. But to give due diligence and oversight to the RQIA, I moved and appointed Christine Collins, MBE, the current chair of the Patient Client Council, to take up that role, to make sure that we have that oversight and scrutiny. And we are moving now to appoint a full board and hope to have that done by the end of July. Michael?
Thank you, Mark, for the question. I just want to put on record my sincere thanks to RQA staff for what has been a very difficult period, as the Minister said, for everyone in health and social care right across Northern Ireland. And no doubt it's also been a challenging period for non-executive members of boards and indeed chairs of boards. I don't think we should underestimate the challenge that individuals have faced in that time. I absolutely believe that the decision to repurpose qualified, experienced social workers, nurses, pharmacists who have experience with the sector, both in terms of the care home sector but also domiciliary care, to provide that support, made a significant contribution in supporting care homes at a very challenging time, with guidance that was being issued and updated on a regular basis, with support through the support unit that was set up by RQIA staff, liaising with health and social care trusts on a range of matters such as management of outbreaks, liaising with the Public Health Agency, provision and supply of PPE. Do I think that made a significant impact in containing outbreaks in care homes in Northern Ireland? Yes, I do, and I just want to put on record my thanks to all concerned. In relation to the other matters, I think those, as Minister indicated, now he's commissioned a review to look at all aspects of that, and I'm very happy that I'll fully cooperate with that process in terms of any evidence or engagement with the review that the Minister has just announced.
Beyond any bureaucratic squabbles that there might be between people working in watchdogs, people working in the department, the wider issue here is the welfare of people in our care homes, many of whom have sadly fallen victim to coronavirus. Are both of you, Minister and Chief Medical Officer, confident that you will emerge positively from any wider inquiry which will be set up into our response to COVID-19, in particular in relation to care homes?
I'm not going to prejudge any findings of any inquiry. I think I've said in front of the committee many times that I am under no doubt there'll be national, international and local inquiries as to how this was handled and how it could be done, and I'll wait to see the outcomes of those findings. Do I think could we have done some things differently? Yes. Had we the rule book, had we the ability of hindsight that we have now? Yes, there's different steps we could have taken, but let's wait and see. We're not through this yet, Mark, and I think that's one thing I want to be clear about to everyone listening to this, to anybody participating, to the media themselves. We are in a good place in regards to today. We're now in our second day with 0 positive cases. We have still 1 death. We have still 1 family bereaved. So this is not over. Let's not be under the perception that we are through this and we're out the other side. This battle continues. And as my role as Health Minister, that's the fight that I'm still fighting.
Just to add to that, Mark, if I may, Minister, I think it's important that we point out that the decision in relation to the reduction in inspection visits was just that, a decision to reduce the frequency of visits, not to stop visits into care homes. Indeed, a number of visits, I think over 40, were carried out subsequent to that paper. It was designed to protect individuals in care homes by reducing footfall and the risk of introducing infection. Minister again announced yesterday that because of the lower transmission rates within Northern Ireland and because of the efforts now being put placed in terms of rebuilding health and social care services, that the inspection regime can recommence. Obviously, it will not be in the same form as before because, again, we need to be very cautious and very careful about potentially inadvertently transmitting and introducing SARS-CoV-2 into care home settings. But RQA have looked at a range of innovative and flexible approaches, including remote inspections, and also including how, as the Minister said earlier, the importance of voice and engaging with carers as well and family members to inform those inspections.
Good afternoon, Vicky Hall from UTV. Firstly, to the Health Minister, the First Minister has said this afternoon that the Prime Minister's announcement in England of social distancing being reduced from 2 metres down to 1 metre as being very significant. Do you agree with that assessment? And perhaps maybe more for Dr. McBride. In your view, from what you've said in your initial statement, are you saying that the scientific evidence is not there yet for us to do the same thing in Northern Ireland in reducing social distancing?
Thanks, Vicky. I do think it is a significant announcement, but I think the Prime Minister also made it clear that it was an announcement for England. The Executive will meet again on Thursday, as I've been said at this podium many times. That will be a decision for the Executive to take. Our medical advice on guidance will remain as it is. We still believe that social distancing is a crucial tool in our fight against COVID-19. Our recommendation still remains at 2 metres. We will discuss further with the Executive on Thursday, and if the Executive comes to a policy decision to reduce from 2 metres lower, that's one that the Executive will take. Michael?
Yeah, I mean, thank you, Vicky, for the question. I mean, these are finely balanced matters. The science is the science, the evidence is the evidence. Yes, certainly evidence and science can change over time. Certainly, I don't believe that the evidence around the droplet spread of SARS-CoV-2 is going to suggest that a distance beneath 2 metres or 1.5 metres is likely to be scientifically based in terms of evidence. However, as you are well aware, a number of countries across Europe have taken different policy decisions, some opting for 1 metre, some 1.5 metres, some 2 metres. But as the Minister said, those are policy decisions. And there are a range of very complex factors that need to be weighed in the balance here. So particularly we've heard on coverage around school environments and obviously the reduced transmission. Well, firstly, the reduced impact of COVID-19 in children and some emerging evidence about probably that children are less likely to transmit COVID-19 to adults. So again, in certain settings, that might be a possibility. And certainly there are other mitigations that can be put in place to minimise risks, such as physical barriers of one sort or another. There are issues such as improved ventilation, which also can be of assistance. But as I say, those are matters which obviously the Executive will wish to return to, I have no doubt, in coming days.
The Prime Minister has also said, though, that the scientific evidence that is being used in England will be shared with the devolved nations. Have you seen that yet? And when do you expect to see that?
Well, we have regular detailed conversations. I spoke with my counterparts across the UK at 8:30 this morning. I haven't seen the detail of that advice that's been provided, but I'm confident that in due course I will.
Good afternoon, Minister and Chief Medical Officer. Rebecca Black from PA Media. Firstly, to the Minister, there's been reports of rise within the Executive yesterday over the gene monitoring round, and I mean, obviously there's been a few issues that have been talked about more. However, I wanted to ask, has your department suffered in this row with the money not being signed off? Had there been bids that you had made and that are also being held up, and if so, what are those bids? And secondly, to both the Minister and the Chief Medical Officer, last week there was a lot of speculation about a potential cluster in Ard's North Down. On the 18th of June, there were significantly more infections in Ard's North Down than anywhere else in Northern Ireland. Has there been any explanation detected for that? Is there any particular reason why it was so much higher in Ard's North Down? And are you sort of vigilant looking out for clusters? And in the event of a spike in a particular area like that, would that lead to localised lockdown being introduced?
Thanks, Rebecca. In your first place, one thing I will not do is disclose the internal conversations of an Executive meeting that haven't been made public, and I don't intend doing that in regards to the gene monitoring round. Yes, we have bids in, we have substantial bids in. Those will become known as in due process. I'll not step outside the confidentiality of the Executive because I don't think that actually serves anyone well. We have a challenging enough situation in regards to tackling COVID-19 and our budgetary pressures, but also in a five-party executive. So it would not be befitting of me to start to air that bid and that discussion in public. In regards to clusters, I'll let the Chief Medical Officer pick up on the specifics, but in our test, trace and track system that we have established under the PHA, it will alert us to any clusters or any clustering of positive cases. So it is something that system is alert to and will inform us of the specifics in North Down. Michael, I'll let you cover.
Yes, obviously I don't want to go into the particular specifics of individuals, particularly where those numbers may be very small in number, because it's about individuals we're talking here. But just on the general point, I mean, I did say many weeks ago at one of the executive briefings that the pattern that we're going to see in the weeks and months ahead is one of localised outbreaks and clusters. And that's the experience in other parts of the world as the lockdown restrictions are gradually eased. We've seen that pattern in Germany, for instance, where there's a significant and fairly large localised outbreak. Similarly, in Wales at present. I think it's a matter of time, despite our best efforts, that because of how transmissible this virus is, that we will see localised outbreaks. What's hugely important is, as the Minister said in his introductory comments, that individuals who get symptoms get tested, and that our contact tracing system, Test, Isolate, Protect, is working efficiently and effectively. And as you know, we were one of the first parts of the United Kingdom to re-establish our contact tracing service, and every evidence is that it's performing very effectively. Contact tracing very high numbers of individuals within the first 48 hours, which to be effective is so crucially important. But I do envisage that we will see clusters and outbreaks in the months ahead. There are particular environments which we know are at greater risk. We know, for instance, that this virus is particularly sensitive to ultraviolet light, so areas that, and work environments, for instance, which don't have much in the way of natural light, where there's, per se, poor ventilation, or where the temperature's cold. So the virus survives very poorly when there's a high ambient temperature, high levels of humidity. So those sorts of environments, and again, we've seen some of those factors play out in the recent large outbreak in Germany.
Right. Thanks for those answers. I did note in his introductory remarks, the Minister did make a specific appeal for people who have symptoms to come forward and be tested. Is there any level of concern that not enough people are coming forward to get tested? And on a colloquial level, people have complained about having to test themselves. I think I spoke to a former nurse who found it difficult to test herself, and that's obviously someone with a medical background. I think in the Republic of Ireland and also in England, people are maybe assisted in that process. Does that give a risk of potentially higher false negative results?
In regards, I suppose, Rebecca, one of the things we were pushed on at the start was how many tests we had and how quickly we can increase our capacity. We have increased our capacity now. What I'm asking people is actually to utilise that capacity. So if anyone has symptoms, we expanded now the definition of those who could avail of testing to anyone who has symptoms to come forward, make the contacts through the Public Health Agency, make the call, log on, use the national testing system that we have access to through the MOT centres, through Derry Rugby Club and all the SSE arena as well. So the tests are now available, and what I'm saying to people, if you think you are symptomatic, come forward, because that's how we battle this virus, by finding out where it is and who has it, so that we can put the appropriate measures into place. In regards to the specifics of the test, I'll let Michael cover
Yeah, there are
that.
a range, as Minister said, there are a range of options. So there are obviously the fixed site testing centres, as Minister has outlined, as part of the national UK-wide testing programme. There are also satellite sites as well, and individuals can book a test online, and as I say, they can also have that posted out to them to their own home. So there are options for those individuals to drive to a fixed test site and have the test carried out there if indeed they are reluctant or concerned about how to do that or how to perform that on themselves. I mean, it's not the most pleasant of tests. I mean, a nasopharyngeal swab is not. Obviously, the testing in and around SARS-CoV-2 continues to improve. I have no doubt in the months ahead we will have other tests which may allow accurate diagnosis without such invasive testing procedures. But those aren't readily available at this moment in time.
Minister, can I ask, in today's Irish News, it is reported that there are radical changes proposed to A&E departments across the north. Can you tell us what stage those proposals are at to restrict public walk-in access to emergency departments? And also, when would the staff working in those A&E departments be informed of these proposed changes? I think we've been contacted by some nurses today who said they were unaware that the proposals were underway until they'd read it in the newspaper.
Yep, Alison, I read the report, as I usually do, read the Irish News every day, and I think I think the story itself also highlights that those are draft conversations that's going on. That's the conversation that come back from the department, the draft response that come actually back from the department. And look, what I've been clear of as well, when I took over this portfolio on the 11th of January, I took over a health service that wasn't in a good place. For me to allow it to get back to that status and that situation would not serve me well, would not serve the people of Northern Ireland well. So there are a number of reviews going across the whole sector. There was a review already been done in regards to the emergency departments and how we manage those in regards to the people who use them, how we utilise them and when we use them, because we saw massive waiting times within our ED departments prior to COVID-19. We have got to a better place at this minute in time, so we can't allow ourselves to slip back to those massive 12-hour waits that we'd already seen.
Can I also ask both the Minister and the Chief Medical Officer, given recent developments and also the high numbers involved, would both of you be in favour of the calls for public inquiry into the handling of the COVID pandemic in nursing homes? Alison,
as I said, I think in response to an earlier question, I've also said it to the Health Committee. I'm under no illusion that there'll be national, international and local inquiries into this. So when they come, they will come, but now is not the right time. As I said earlier as well, we are still fighting COVID-19. There will be a time for inquiries, but let us get through this battle first. Let us get to a place where we can get a functioning health service. That's where we can get to a place to those who would be called to inquiries to give evidence, to support those who need to give evidence, have actually the time and the space to do that. Michael, do you want
thank you, Alison, for your question. And I think, as Minister said already, and I think I'm on record myself as saying that there will clearly be learning from all of this when we look back. I think it's important that we all remember that there was much that we didn't know about this virus. There was much learning that has emerged since the emergence of this. We hadn't heard of the virus, back until the end of December of last year. We now know a lot more. We have thankfully now begun to see drug treatments emerge. We had a testing capacity of some 40 tests per day in Northern Ireland when this first started, and we started testing locally in mid-February. Certainly there are things we know now that we didn't know then. I think it's important that certainly in preparation for any next wave that we establish the learning that has occurred over the last number of months. But there will be a time and a place for looking back over all of this, establishing decisions that were made at a point in time, whether different decisions should have made, because it's crucially important that we learn for any future pandemics. But as Minister said, now is the time not to get deflected from doing our job, from those in the front line doing their job, and from all of us doing our job. We're at the end of the beginning of our response to COVID-19, and there is a long way to run in this pandemic yet.
Hi, Niall Beanie here from the newsletter. This is a question for the Minister. Just to sort of follow up on what Alison Morris has just asked in terms of public inquiry. You've said that when the time comes, you're sure that there will be inquiries locally, nationally and internationally. Would you be minded to order such an inquiry yourself when the time does come?
Niall, I honestly believe it'll be a wider inquiry than just health. Because when we do need to look locally, we need to look at the responses of government, of our health and social care trusts, of how we as a government responded to COVID-19. So solely to tie down an inquiry for the health response, I think, would be unfair and also unjust, because this was a collective reaction. I think in Northern Ireland we have coped well. There has been lives lost, and each one of those is a life that I regret that has been lost. But we need to look at this, I think, and we need to learn from what we did and how we done it. So I don't think solely a health inquiry would benefit us from what we have learned and what we need to learn.
Just to follow up on that, the Trade Union Unison, along with the Amnesty International and the Committee on the Administration of Justice, has called for an inquiry to be ordered, given the high number of deaths in care homes specifically. Could I just ask you to give us your reaction to those calls, specifically on the issue of care homes?
In regards to care homes, I've already commissioned and asked for a rapid response inquiry. That's been headed up by our Chief Nursing Officer. I think I announced that a couple of weeks ago. So that is looking at every aspect of the response that was given to care homes and every support that was given to care homes as well. So that piece of work is already ongoing. That's about learnings, that's not an inquiry. So it's not an investigation. It's about how and if a second wave comes, how we can make sure that the support that we give to care homes is beneficial, is practical, and it's in the right place at the right time as well. And just so you don't feel, I'll read the newsletter every morning as well, Niall, as well, not just the Irish News.
Glad to hear it.
Thank you.